Hey everyone, today we're going to talk about a very tragic story of one family and how their tragedy became even worse because of one person. Let's get into it. So there was a Reddit post, and let's say the poster, her name was Janet, and Janet was going about her day. She was picking up the kids from school, making sure that dinner was ready, starting to do homework with the kids, and she gets a call. And the call is from Sherry. And Sherry is the wife of Janet's father-in-law, Bob. And Sherry tells Janet, "I'm so sorry, Janet. I don't know what else to do. Bob just had a stroke and he was just taken in the ambulance and we're now at the hospital. He's in ICU. I just want to let you know what's going on." And she hangs up. Janet, this bomb just was dropped on her, and she said, "What do we do? Do we need to get out there? We're not in the same state. We need to find someone to watch the kids. Do we take the kids with us? What do we do?" So she's talking with her husband, and they're saying, "Well, we need more information." So they're frantically calling Sherry, trying to figure out, "Sherry, what's going on? Do we need to get out there right now? What's going on with Bob?" And eventually they find out from Sherry after a day that Bob had been in ICU and they had stabilized his condition. He was okay, he's stable, and the only thing is that he's on a vent right now, but he's in stable condition. But Sherry says they want to move Bob out of ICU because they don't need him in ICU and he doesn't need that level of care. And Janet says, "Well, okay, that makes sense. What are they planning to do?" And Sherry explains to them that the hospital that they're at doesn't have any other departments that can handle Bob's situation with being on a vent after a stroke. And so the hospital wanted to move Bob over to a long-term acute care facility to help him recover and rehab. And that made sense to get him transferred over because he's not really needing the ICU care and he just needs to get a little bit better, and then that way he can go home. But here's the roadblock that his Medicare Advantage plan put in place. They required a prior authorization. Prior authorizations are requests by the insurance company saying, "We need you to tell us what you want to get done and we are going to decide on whether we approve it or not." This can go smoothly, this can go very challengingly. In this situation, it was very, very much a challenge. The prior authorization was denied. The doctor said, "Well, we need to appeal it." The appeal was denied. They requested what's called a peer-to-peer, where the doctor speaks with a peer from the insurance company to determine, can we move him out of the ICU in our hospital and over to the long-term care facility where we have a bed ready, and it was denied. The insurance company claimed that he needed to remain in the acute care facility, the hospital, because of his condition and his situation. And the hospital said, "No, that's not the case." But it was denied. So the caseworker who's been in the mix of all of this, their job is to kind of manage the situation for patients, talked to Sherry and said, "Sherry, we can put him on original Medicare and then we don't need the prior authorization to get him over to that long-term care facility. And that Bob can qualify to get a Medicare supplement and it will all work out. You may have to pay a little bit more for the supplement than the Medicare Advantage plan, but everything will work out." Now, this is where things took a bit of a turn. The caseworker, being a non-insurance licensed person, did not explain to Sherry that in order for Bob to get on a Medicare supplement plan, because he didn't have an open enrollment, which is the 6 months of when you turn 65, to get on a supplement with no medical questions, and he didn't have another guaranteed issue reason, he had to go through medical underwriting. And because Bob is in the hospital, and Bob also has other serious medical conditions, there was no supplement that would accept him. And even if there was a supplement that would accept him, they would likely put him at a very, very, very high premium, because supplements are able to charge higher premiums if they choose to take on a particular patient who has certain medical conditions and a medical situation, if they choose to take him on, which would have been unaffordable for them, according to Janet. And so they said, "Well, we shouldn't do that." But unfortunately, Sherry's still talking with this caseworker. The caseworker convinced her to do it. So now Bob no longer has that Medicare Advantage plan. He is on original Medicare because he did it during the first 3 months of the year, January, February, March, where you can make a change. And now he's kind of stuck in original Medicare because he can now not get a supplement. Now, for anybody who has been following and knows that original Medicare only covers just about 80% of the bills, there are certain deductibles and different copays that you kind of look at, but as a general rule, it's 80%. The 20% that is the patient's responsibility isn't covered by anything, and there's no maximum. So ultimately, because he's on original Medicare, at the beginning of the year, he can't get something to help him until, let's say, the next enrollment period, which is October 15th to December 7th is the annual enrollment period, but that doesn't start till January. And all those medical bills will be paid under Medicare, but Medicare's only going to pay their part of it. Bob and Sherry will have to pay the other part, which likely could financially bankrupt them for this. So that is problem number one. Now, how do we figure out how to get out of that situation? Well, let's look at what I would do for them to help them get out of that situation. I would first call Medicare, and on your Medicare card, there's actually the phone number. It's actually 1-800-MEDICARE. And I would talk with the representative, explain to them the situation that we got advice from a non-insurance licensed person to disenroll from our Medicare Advantage plan because they were saying that we could get on a supplement with no problems. And they were given false information or incorrect information and appeal to the representative to see if they would be able to get them back onto that Medicare Advantage plan. Now, in this situation, that's the only group of people, organization that can actually put everything back because they will provide that exception for certain situations to put everything back to the way it was. If that was the case and they do accept that situation and Medicare says, okay, we will put back the Medicare Advantage plan. Okay, we're back into a situation where, okay, finances are a little more manageable. But again, we are still stuck with that original problem of the prior authorization. Now, the prior authorization situation didn't go away. So how would somebody get beyond that? And this is, again, what I would do to try to help somebody. Now, number one, I would check to see if Bob has a Medicare Advantage or Medicare insurance agent that helped him. And normally you're going to want somebody who is able to advocate for you or for your family member when you're looking for an insurance agent, which is something that is important because you want to interview these agents to make sure that they'll be there to help you. If he doesn't, then we need to find somebody who is willing to help. And there are some Medicare advocacy groups out there. The first thing I would also do after you do that is get a authorization for release of information for Janet or whoever's going to really take charge of getting this information. Because to add another tragedy to this story is Sherry actually is diagnosed with terminal cancer. She has a lot of treatments that she has to go to. She's a 2-hour drive to get those treatments. There's a lot of bills piling up on her where Bob really can't help. So in my experience, I would suggest Janet or somebody who is willing to take and step forward and take charge to really trying to get this prior authorization done. That may not be Sherry. But once she gets that authorization for release of information to provide to Janet and really try to organize everything, it could come all the way up to a power of attorney if Bob is able to sign one. Beyond the authorization for release of information. Once that's done, the agent or the representative who is advocating for them will or should need to get on a 3-way call with the insurance company and Janet or whoever it is to do the 3-way call, find out more information, find out why it was denied, what do we need to do, what are the qualifications to get admitted into this long-term acute care facility. And once they gather all that information, then we can make a decision on what we need to do. But even if, let's say, the representative says, no, we won't provide that information, we can't, they need to be very insistent. You need to be able to ask those questions and get to a supervisor to provide that information to you so you know what needs to be done to get into that long-term acute care facility. Now, even if Bob had to stay in ICU, which the insurance would pay actually because he needed to stay in ICU, there was no other option for him, they would continue to pay it because under Medicare, they're going to pay up to 90 days, and a lot of Medicare Advantage plans will pay beyond that. That is going to be okay for Bob's situation, but because the hospital wants to get him out of there, that's the problem. So what I would suggest is really try to gather that information, see what the next step is to try to get Bob out of there, and really be active in engaging with the insurance company, because if you just rely on the caseworkers or rely on the hospital or facilities and the insurance companies just to talk to each other, you may not get the result that you want. So I would be as involved as possible. Now, I don't know if this is going to get to them. I hope somehow this information gets to them and they can actually really get that help they need. But if you, yourself, your family members, you're in a very similar situation, I hope this is helpful to try to get over an extreme tragedy like this. I hope you never run into something like this, but there are situations where these things happen. And hopefully this gets resolved in a very, very positive way. Thank you. Please like, subscribe, share this, because it is useful, honest information on how to navigate the Medicare health system to try to get the care that you need. Thank you, and I will see you in the next one.